Hello, my name is Dr. Barash and I am practicing aesthetic medicine for the last 10 years. Today I'm going to use the crystals, calcium hydroxyapatite based filler, which is suitable for correction various fascial deficiency like temporal fossa deficiency, the cheekbones, the malar fossa area, nasolabial, mandibular lines and chin. The product is especially suitable for such treatment since it's biodegradable, it's causing almost no discomfort, and it's long-lasting. Today I'll show you how we treat the area of the malar fossa and the nasolabial. As we can see in this patient, she has a deficiency in this area, in the malar fossa and a little bit of the nasolabial. And for those areas, we using the Crystallis hydroxyapatite based filler. The crystals is coming in a syringe of 1.25 cc. The material is a little bit hyperviscosity and condensed, so to avoid pain while injecting, I suggest to mix it with 0.2 lidocaine 2%. For that matter, I use a small converter. I take the 1.25 cc of the Crystallis material, combine it with the 0.2 millimeters of lidocaine, and I mix them together in such a way that it will be an even and smooth material, so it will be very easy to inject. I suggest 10 times of movements, so the solution will be even and smooth. First, we are going to mark the relevant areas in which we want to work. This will be the area of the cheek, of the malar fossa, and the area of the nasolabial. The injection can be done by needle. I personally use the cannula, and for these areas I use either the 25 gauge or the 27 gauge, and with a pre-needle of 23 gauge. I'll pick this point for the pre-hole needle since this area can be used either for the nasolabial and for the malar fossa injection. I'll put some 0.1, 0.2 lidocaine in the area of the pre-hole needle. I use the pre-hole needle to make a small puncture, point of entry. It's very important to inject this material in very deep layers, subcutaneous and even periost area. We can use the few methods, either the fan methods or the bolus method, a retrograde injection. I can from here go to the nasolabial area with the retrograde injection. I'll do some massage to displace the material evenly. We'll finish the right side, and you can see how volume it gets, how nice it looks compared to the deficiency she has in the right side. Now we go to the other side to complete the procedure. זה תתעדי עכשיו, תוכל לצלם.
זה פשוט ממשיך, זה ההזרקה עצמה, נכון?
כן.
זהו.
Yeah. We finished the right side, and we can see very clear that she gets some volume in both sides, very nice and even. There is some redness, but this is usually goes away after a few days, and also the swelling because of the maneuvers. And you can see very beautifully that she has very nice cheeks with less pronounced nasolabial folds, and she's very satisfied. This patient wants to increase the volume of the cheeks and a little bit diminish the nasolabial fold. So we do treatment in both cheeks and nasolabial. And for that matter, we use the Crystalis calcium hydroxyapatite, which is very suitable for treatment in those areas. We will mark the areas in which we want to work in. It's this cheeks and the nasolabial. You can see very prominent, pronounced nasolabial fold. It's a little bit asymmetry between both sides. This is much more than the other, so we might add this side a little bit more material. Okay, cut. Small injection of lidocaine in the point of entry of the pre-hole needle. That's a pre-hole needle. Then we start the injection. We finished the left side. We can see the difference between the side which we put the hydroxyapatite, the Crystalis, and the other one, which is still with the deficiency of volume. And we mark this area where we're going to work. A little bit here. We put some local anesthesia of lidocaine in the place of the pre-hole. We finished the treatment. We did both cheeks with the Crystalis. We put 2 syringe in each side, and it looks even and very nice. And also we touch a little bit the nasolabial, so she got a very nice and gentle round face.